So now I guess Gabriely will share the screen. I'll have a presentation on mobility related to public health.
Yes, I'm sharing here.
And the presentation will be made by Gabriely, Pereira, and Lucas Stankus. They are both graduate students. Gabriely, graduate student, and Lucas, a graduate to be graduate student at the University of São Paulo.
Yep.
This is work in collaboration with Paulo Meirelles and Luciano da Fontoura Costa. So please go ahead, Gabriely.
Thank you, Fabio, for the introduction. And so I'm Lucas Stankus, and I'm going to talk about our data science work with the Brazilian national health data. So giving context to our work, there's been a significant growth in healthcare data generated from health facilities. And this information could be very helpful to public managers. But this data is mainly composed of large collections of heterogeneous data that can be very hard to analyze without proper visualization tools. Based on that, we are aiming to develop large-scale data visualization platforms to support evidence-based public policymaking. The main goals of our work are to provide open-source health data visualization tools in order to promote evidence-based public health policymaking. And hopefully with that, we can influence Brazilian public managers to adopt an evidence-based, data-driven approach to healthcare management and planning. So we're currently working on 3 platforms with different scopes. The first one is the HealthDashboard, which is a city public health management tool. The second one is SUS, which is a multi-level patient mobility analysis tool. And lastly, we have SUS Regionalization, which aims to validate and further analysis of health regions. We're going to talk more in depth about these platforms in the later slides. And the datasets we've been using to support these platforms are provided by the Brazilian National Health System, the SUS, which serves around 109 million users across the country. And the main datasets from them we're using are the Hospital Information System, the SIH-SUS, which is a hospitalization data set that covers around 70% of hospitalizations in Brazil. And to give a dimension to the data set, since its creation, it has stored over 285 million procedures. The other data set is the National Health Facility Census, the CNAS, which is a health facilities data set that logs all health facilities across the country. And both of them are very rich data sets, including administrative information, geolocation, and related logs. So talking about the platforms themselves now, the first one, we have the HealthDashboard. This is a citywide dashboard for health procedure visualization. And in its current version, it has over 1 million procedures from the SIH-SUS dataset, spanning 2 years of a city in Brazil. And its main feature is the advanced search with composable filters, where the user can freely add filters to the data. They can filter by health facilities, such as information such as administration, number of beds, by patient information such as age, sex, and education level, and by procedure information such as main diagnosis, complexity, and bed specialty. This filter data can then be displayed in multiple visualizations such as maps, graphs, and various tables. So now looking at the platform view, this is the main page where we have the main map visualization and where we also can apply filters. Firstly, we are showing all the procedures from the dataset in clusters and also showing the city limits and the facilities. We can also show the procedures in heat maps in the next slide. Yep, and we're also hiding the facilities just to clean up the view a bit. And starting with the filtering, we can firstly apply a filter by diagnosis. We're filtering by myocardial infarction here, and the number of procedures shrink quite a lot, but the data is still spread out around the city. So, for example, if we actually want to analyze regions without proper support, we can add more filters to the data. So we're composing now with procedures where the person had to travel over 15 kilometers to reach the health facility. And 15 kilometers may not seem a lot, but considering this is a high density region, a high density city, where people can take more than an hour to reach the destination in such distances, this is very relevant. And the main regions are the highlighted ones. These regions are really interesting because they have a high concentration of procedures, but probably indicating that they are not properly supported by the national health system. And these regions are low-income areas of the city, so they might indicate that the patient had to use public transportation to reach the health facility, so indicating vulnerable regions to the health officials. We can also show other things, other visualizations. So we are now filtering by 2 health facilities and showing the percentile circles of them. So respectively, the blue, green, and red circles encompass 25, 50, and 75% of hospitalizations. So they can show the pattern of service of the facilities. And in this case, as you may see, one of the facilities attend most of the city, while the other only the close neighborhoods. And that's it. I'm going to pass on to Gabriely now to talk about the SUS Distance platform.
Okay, thank you, Lucas. So, hi everyone. The second platform we're going to show you is called the SUS Distance, and it is an interactive web platform created to analyze the population distance to the nearest emergency facility. And to do this, we used some population data and the health facilities data set, the CNAS. So from now on, we're going to use the state of Rio de Janeiro as an example. In this case, this map represents the accessibility situation all over the state, showing the average distance to the nearest emergency facility for each city here. So here, the dark blue means that the population is closer to the emergency facility, and going to the dark red, the distance to it increases. So, for example, the average distance of the city of Rio de Janeiro, the state capital, is about 1.7 kilometers. And otherwise, this other city here, its average distance is about 9 kilometers. So this entire map can show us how the emergency facilities are distributed all over the state. Also, these platforms is available in different levels of visualization. So here, for example, we can analyze the emergency accessibility situation all over the country. Here you can see more details for each state, in this case, the state of Rio de Janeiro. And here you can see even more details analyzing each city separately, in this case, the city of Rio de Janeiro. Now we're going to show the third project, the SUS Regionalization. And this project aims to analyze the health regionalization process here in Brazil. So in the 1990s, the federal government started to adopt a health regionalization process here. So what is it? Ideally, a health region should provide enough health services for all your patients or your population. And here, a health region is defined by a collection of adjacent municipalities. So in this example, this white lines represents the limits of the health regions, and this gray lines represents the limits of the cities. So again, ideally, the patients of one health region shouldn't cross these white lines to be hospitalized. Ideally, a health region should provide enough services for your patients. And these limits are organized by health managers in order to provide health services more efficiently. And it's an ongoing process, so we can change in time in order to improve the accessibility and the efficiency of the health services. So we developed this research to analyze the health regionalization efficiency. And to analyze it, we're using the patient mobility to the health service, the patient flow network, just like this example here. And we use the national hospitalization dataset and some complex network methods to analyze it. Okay. The community detection algorithms are complex network methods to find clusters in a network. In this case, it finds communities in a network. So these algorithms find these communities based on the patient flow between municipalities, just like this patient flow between different municipalities. And we tested different algorithms, and here we're showing the result for the InfoMap algorithm. And we use these methods to study the similarity between the health regions, represented here by these black lines, and the detected communities represented by these different colors. And doing this, we can see where they're very similar, such like this orange one or this pink one here, and where they're not very similar. And this can provide some insights to health managers to where the health regions organization may or may not be working very well, maybe here, for example. So our ongoing work now is for HealthDashboard. We are working to promote the use of our platforms in multiple cities. For SUS Distance, we are working to provide a platform to analyze the accessibility to different kinds of health services. Because right now, this platform analyzes the accessibility only to emergency facilities. But it's interesting to analyze to different kinds, just like maternity, for example. And for the SUS regionalization, we are working to analyze the patient flow in a diagnosis perspective. Right now, we're looking to the entire hospitalization data set. We do not restrict the diagnosis, but we can also do this to analyze the efficiency of the health regions in this different perspective for different disease or diagnosis, such like just like heart failure, pregnancy, or for external causes, for example. So that's all. Thank you for your attention. Feel free to mail us for more information, for any comments. And we have some time for questions now. Thank you.
Okay, thank you, Gabriely. So we have time for 1 or 2 questions. Any question about mobility and health? Be courageous. It can be in Portuguese. No question? If not, I will have to create a question. Let's see. Gabriely, do you expect that the flows for different diseases will be very different from because right now you are showing the aggregate flow for hospitalizations for all diseases. Do you believe that if you separate in different types of diseases, the flows will be very different?
Mm-hmm. Yes, I do believe it will be very different. The SIH is composed mainly, I guess, about 80% of pregnancy-related procedures. So if we remove these procedures, for example, the result will be very different.
Mm-hmm. Okay. Then Beatriz, do you want to speak your comment? Can be in Portuguese if you prefer.
Sure. It's a really short one. Just pointing out, it would be really interesting to extend the research to analyze SARS flows, severe acute respiratory syndrome, right, before and after the COVID-19 pandemic, to see in a granular time perspective as well, because we know that systems were under more or less pressure over time. So just a thought for an extension.
Oh, thank you.
Yeah, an interesting thing related to that is if the pandemic changed the pattern persistently after the pandemic, because Gabriely has a good amount of data to analyze the flows before the pandemic, and now we are starting to have access to the data during the pandemic. But I wonder, in a few years from now, we'll be able to. Thank you, Ewan. And a few years from now, we'll be able to check if the pandemic affected in a persistent manner the flow of patients in the country. I would guess that at least a little bit, it will affect in a persistent way. Okay, thank you very much. So thank you everybody for participating, and we'll have our next webinar in a few weeks, and we'll let you know both the exact date and time and the topics that will be covered, so you can decide if you want to attend again or not. I hope you'll attend, because there are a lot of interesting talks we will have from other universities in Brazil that also collaborate with our research project in the InterSCity project. And we'll have a very interesting invited keynote from Ireland, but you received all the details about the international keynote also by mail. So thank you. Bye-bye. See you next time. Stay safe away from the COVID, since the pandemic is finally ending, hopefully.